If you've woken to sensations or pain below your injury level, and the pain is really bad, try sitting up in bed if you can, or transfer to your chair so you can move to a different room for a few minutes. Over time, you'll figure out what works best for you. Ideally, you'll know what the least amount of repositioning is needed for you to interrupt the pain and reset your mind so you can calm the pain sensations and go back to sleep. Once you're in a comfortable and safe position, start to focus on your breath. Take a slow, gentle breath in through your nose and exhale softly through your mouth. Notice where you feel the breath coming in and going out. You're safe right now. Once you're in a comfortable and safe position, start to focus on your breath. Take a slow, gentle breath in through your nose and exhale softly through your mouth. Notice where you feel the breath coming in and going out. Sometimes when we're quiet or asleep, the brain becomes more alert, as if it's standing guard. Those signals of tingling, tightness, or burning, they're just the brain's way of checking in with us. It wakes us up because it wants to confirm that we're okay. It's both unfortunate and unnecessary. But these sensations, they're just false alarms from an overprotective brain. Calmly remind your brain, I'm safe. I know there's no structural damage. These sensations are just noise. I'm going to rest now. Take 3 nice, long, deep breaths. Now, gently bring attention to your body below your injury, to the areas where you notice sensations of discomfort. Observe what's actually there, perhaps warmth, tingling, buzzing, maybe a sense of pressure. You're not trying to change these sensations, you're just observing. Imagine yourself snorkeling, you're floating in the water and you can see all the different fish life and sea life. You can watch them come and go, but you don't control them. Those sensations in your lower body, you can tell your brain, this is my nervous system on high alert. These sensations, I know they're coming from my brain. I know I don't have a structural problem. My spinal cord injury was a long time ago, and that area is stable. Again, you can say to yourself, this is my nervous system on high alert. It does not need to be sending me those sensations. I don't have a structural problem. Each time you notice this sensation without fear, your brain learns that it's safe and that those sensations causing discomfort are unnecessary. Now, bring awareness to the space around those sensations. Even while they're present, remind yourself, I'm okay. I'm safe. You can even say to your brain, thanks brain, but I don't need your protection right now. I'm good. Continue to breathe gently in and out through those sensations. You're not fighting it, just giving it space. Remind yourself, I'm safe. These sensations, they're just noise. There's nothing wrong with my body. I can sleep. Because this pain is neuroplastic, not structural, in addition to this mental work we're doing, because this pain is neuroplastic, not structural, in addition to the mental work we're doing, you can also use gentle touch to show your brain that it's confused. If you can safely reach the area that's causing you discomfort, with your hand you can rub the skin. And you can actually notice if there's a difference between how your hand feels on your skin, like maybe it's cool or just neutral, versus the sensations your mind is generating, like burning or electrical or pulsing. Think or say quietly, hey brain, you're not making sense. You're giving me these hot sensations, but my skin is cool to touch. I know there's nothing wrong with me. When the sensations between touch and what our brain is serving up are different, well, now we have even more evidence that the brain is being overprotective and that this plastic pain can be unlearned. If you're a complete injury, now that evidence is even stronger. By touching our skin below our injury, we're giving our brain some real data. See, brain, look, this area is calm. It's safe to feel. If you can't reach the area, that's okay. Simply visualize touching it. Or place your hands on another accessible spot, like your arms. And as you gently rub them, imagine warmth and calm spreading through the area below your injury. Gentle rubbing or tapping, it tells our nervous system that movement and touch here, they're not dangerous. Try not to be frustrated or disappointed that these sensations appear when you'd rather be sleeping. Frustration, it just feeds the danger signal. Instead, be patient with your brain. Treat it like a small child. Say softly, hey brain, I know you're just checking in because it's quiet, but I'm okay. There's nothing to worry about. I can relax. I'm safe. I'm resting. If the sensations move, change, or fade, just let them. You're just observing. But if they move, note, because that's more evidence again that the sensations, they don't need to be there. It's not structural. And the more accepting you are of these sensations, the more the brain relaxes its guard. Over time, we should see that dial turn down. Have a look again at those sensations. Have they changed? Are they a different shape or a different color from what you would have originally seen? Slowly, you can return your focus to your breath. Slow, rhythmic, easy. Your body's good at resting. Each calm breath you take, it tells your brain there's no danger here. Say to yourself, I'm safe. I'm healing. My brain can now rest. Repeat this or come up with your own mantra. I'll often say, There's no pain in my brain. There's no heat in my feet. Take a couple more nice long breaths. As you start to feel tired again, you can settle back into bed. If the sensations are still strong, you can gently scratch or tap your head or gently rub your arm while counting each out breath until you fall back to sleep. Well done.